Hey guys, Dr. Nicholas Beasley here from Wood Medicine. Today we're going to talk about something that a patient of mine has been suffering with, and he'd like to have a little bit more information, and that's peripheral neuropathy. Peripheral neuropathy basically describes a symptom of a cluster of symptoms which includes any tingling, extra sensitivity, loss of sensitivity or loss of sensation, any buzzing sensation, poor circulation, and a wearing of muscles in one of the extremities. So peripheral meaning like away from the center of the body, and neuropathy meaning like basically weakening or decaying of the neural firing and so forth. So let's just break it down here. So in Western medicine, what we do know is that peripheral neuropathy is often associated with a lot of conditions such as diabetes. It's associated with trauma, any injuries to areas, any surgery. You can get neuropathy as a symptom of any nerve damage, and so forth. So there's many different things, even including certain bacterial infections. And they are really good at describing, what's potential things that cause, but no one really knows exactly what causes peripheral neuropathy and why it affects some people more than the other. What we do know is that there's certain nerves that are involved, such as the motor nerves, which actually stimulate the muscle activity, are actually inhibited, and they're not working, or they're not receiving enough information to actually create any changes in the muscle. So in Chinese medicine, it's quite simple. We refer to anything like this as a blood stasis pattern. So essentially the nerves are not receiving enough nutrients, enough blood, enough oxygen for the nerves to actually have an effect. So this is a common cause. We look at the things that can cause blood stasis, and the most common one is basically excessive cold. Excessive cold, and usually patients, when they come into a clinic with this, they will have cold extremities, they will have a weakening and a very thin pulse, very, very thin and tight, weak pulse. And this is because basically something's happened, either a trauma or toxins that kind of build up in the blood, any surgeries and so forth, which have damaged some of the nerve endings, and then it's basically left the area that's fed depleted of blood flow. When people have an injury, the first thing that they often experience is pain. If the pain's left for a long period of time, it will lead to numbness and tingling and so forth. And eventually this will just cause a withering and a weakening of the muscles. And so in Chinese medicine, there's two kind of major patterns. Obviously, we talked about the cold pattern, and that's usually the most stubborn, a little bit more advanced neuropathy that we deal with. But there's also a hot pattern. So let's just quickly talk about the cold pattern. Usually in the pulse, it's a very thin, tight pulse. Patients usually cold in all of the limbs, and it's an advanced blood stasis pattern. Often in these cases here, patients respond really well to acupuncture, but really well to warmth, really well to warm herbs and warm kind of sensation. Heat lamps, moxa, everything like that to warm, stimulate the circulation in the body. So that's the first one. We do, we'd say 10% of the time you will get a case of a heat pattern, and often see that with carpal tunnel syndrome, when there's a lot of inflammation in the area there and so forth, or if the patient's overweight or anything like that, or holding too much water, and there's a swelling that happens. And carpal tunnel is probably one of the most common things that we see in that situation. A little bit easier to treat, or it reacts a little bit more immediately to treatment, because we're just basically cooling the body down, de-swelling the body and taking away inflammation of the nerve, and that calms it down. One of the most interesting things about peripheral neuropathy is that MRIs are not going to detect if there's any inflammation or any swelling or irritation to nerves. So it's really important that when we are discussing this, that we're aware that acupuncture has a really good opportunity, because acupuncture stimulates peripheral nerves anyway. We're using the proprioceptive pathways, and this will basically increase blood flow into an area, which can feed that. If the patient responds well to treatment, then often it's something that they will be able to continue with and see gradual results as the weeks go by. If it's something that doesn't get some reaction, then the damage is probably quite severe and will need a little bit more of a look at from some professionals. So this is just a little bit of my take. I've had it quite a few times. Often it's a result of a secondary condition, such as spinal surgery or any brain surgery or anything like that. Can be difficult to treat, but often the patient will give good feedback immediately and it will help. Blood movers, thrombolytics, formulas are really useful as well. So definitely seek out some herbal medicine help from any professional. And yes, if you're suffering from any of these conditions, just leave a comment below and I'll get back to you. 谢谢。